The idea of explainable AI is centered around a couple variables. One, most notably, is trust. So if a clinician can trust a system based on the variables to which they have been trained on that act as a primary driver for their decisions, you have to understand when to provide them with that information and how to provide them with that information, whether it's visually, through different text, through different points of their workflow. It may sound trivial, but in the real world, when you try to incorporate these things into clinical practice, they're simply not going to get adopted unless you do some systematic thinking about how this is going to be used in the real world. One of the biggest things, especially where cognitive model engineering comes into play, is really reducing the bandwidth demand from clinicians. So you try to, from a usability standpoint, reduce the number of steps that they have to go through to finish an action. But at the same time, there's trade-offs there between freedom of action and control.